Consider this question. During a psychotherapy session, your client expresses to you thoughts of harming someone. What do? Do you maintain strict confidentiality with your client? Do you set aside confidentiality and warn the target of potential harm? Do you notify authorities? What is your ethical responsibility? How do you arrive at a decision? I'm going to talk about our book, which covers this and many other important ethics topics. I am Dr. Jack Haynes, licensed psychologist, and I have been a psychologist for 50 years. I have been president of the Michigan Psychological Association, and especially, I also have had the great honor of being on the American Psychological Association Ethics Committee, as well as being an APA Chair of Ethics. My co-author, Jim Wendell, also brings 50 years of experience as a psychologist, as well as being the author of nearly 40 books. Jim has worked in court and in other criminal justice contexts, and he also has a national reputation for award-winning parenting programs. For both of us, ethics is a central and organizing issue in mental health work. Together, Jim and I designed and wrote Ethical Challenges for Mental Health Professionals, Your Questions Answered. Our goal was to develop an essential and practical resource for all mental health professionals, including not only psychologists, but also social workers, psychiatrists, licensed professional counselors, and marriage and family therapists. The book also is a resource for psychiatric nurse practitioners. All mental health professionals sometimes are challenged by perplexing and apparently conflicting issues in mental health work. It is important to approach professional work from a strong ethical perspective. In a sense, if an ethics code is thought of as a compass that helps with navigation, our book is more of a detailed map to help the mental health professional traverse sometimes challenging and uncertain terrain when more general directions sometimes fail. An ethics code provides structure and guidelines, but it is not a cookbook with easy-to-follow specific directions. In professional work, situations arise that are more complicated and more nuanced than any ethics code can readily resolve. Even a remarkably detailed and useful code like the APA Ethics Code. We try to address these sometimes complicated and challenging scenarios. We also strongly believe that ethical professional behavior protects both the client and also the professional. Our book is organized by topic so that it can be used as a handy reference. It is unique in that it uses the overall structure and format of a question and answer approach through the 21 chapters. We recognize that professionals are frequently confronted with ethical challenges and questions, and so we ask and answer some of them directly. Each chapter of the book has several vignettes that present specific ethical dilemmas. In total, more than 75 vignettes are in the book. In tandem with these scenarios, the Q&A sections offer specific examination and ways of considering these situations. Our continuing goal is to encourage the reader to think ethically. Throughout the book, we cite specific and relevant ethical principles and standards. Also, at times, we briefly discuss important, relevant legal decisions. We encourage the reader to engage in critical thinking, to be flexible, and to apply ethical principles and standards to their unique decision-making situations. Our book covers a comprehensive range of important ethical issues based in the ethical principle/ethical standard format of the APA Ethics Code. We also present and discuss other mental health profession ethics codes. I will reference here a sample of about a dozen ethical topics covered in depth in our book. For example, foundational principles. Our book describes and emphasizes the central organizing values and principles of mental health ethics codes. We discuss these central principles and that they are related to specific operational and enforceable ethical standards. Confidentiality. Confidentiality is central to mental health professional functioning. In the book, we also discuss the concept of privacy. Confidentiality forms the basis of professional trust. We discuss confidentiality as well as exceptions to confidentiality. We consider confidentiality regarding the duty to warn and the duty to protect, and how they relate to preventing harm to others, including to the clients themselves. Informed consent. We examine informed consent as not just a one and done document. The content of informed consent is discussed, as are voluntary consent and client competence issues. We discuss working with minors where state laws govern the age of consent for mental health treatment. There also are informed consent implications for court-related evaluations. The book discusses the importance of definition of who the client is, which is often different and more complex in court-related work. Professional competence. Competence includes knowledge, training, judgment, and experience. Competence is foundational to ethical functioning in mental health practice. Both competence and the use of ethical knowledge are essential for ethical practice. Sound ethics helps clarify and justify ethical decisions in clinical practice. A solid foundation of knowledge and also clarity, consistency, and predictability are important in decision making. For example, it is possible for a mental health professional, in an effort to try to help, may veer into problematic decision making if they are ethically uninformed. Ethical functioning also is essential for building client trust and for developing a therapeutic alliance. We offer specific recommendations regarding being ethically proactive, maintaining healthy boundaries, and emphasizing competence. All right, another topic is multiple relationships and boundaries. Our book details how to handle these ethically perilous situations. We focus on different types of dual relationships, both business-based and socially involved. We discuss the ethics of accepting gifts from clients. We present examples of potential harm to clients from impaired objectivity and insufficient boundaries, and hence impaired competence, resulting often in exploitation. Physical intimacy and exploitation. Sexual relationships with current or past clients or their family members are discussed. Our book discusses the highly specific and enumerated criteria in the APA code regarding permissibility. We also discuss the ethical perspective of once a client, always a client. Telehealth and technology. The developing and evolving areas of telehealth and artificial intelligence are discussed. Issues of competence and confidentiality are presented if AI services are utilized. Secure platforms are essential to maintain confidentiality. Another topic, court and other forensic work. Distinctions between clinical and forensic work are discussed, including ethical implications, impartiality, specialized training, experience, and competence are central. We discuss characteristics of quality forensic work. Another important area is vulnerable populations. There are several groups that can be viewed as vulnerable, and special awareness and care may be required from an ethical perspective. This includes children, the elderly, with special legal reporting requirements with which all mental health professionals should be familiar. Cognitive developmental issues also can dovetail with ethical issues. Additionally, the LGBTQ plus community can be viewed as vulnerable, in part because of the societal viewpoints and reactions of some. The importance of understanding LGBTQ plus identity issues is discussed. Additionally, individuals who are handicapped also are potentially vulnerable. Issues often focus on autonomy, beneficence, and the ability to consent. Another topic we cover is ethical decision-making models, or EDM. EDM models can help organize, clarify, and prioritize ethical considerations. We evaluate several EDM models and discuss the advantages and limitations. Our book also examines such issues as how to handle competing ethical values. Additionally, we have a definite section on special situations. In other words, in there, among other things, we cover barter, fee splitting, and plagiarism in detail. Risks and qualifiers are presented. Ethical Challenges for Mental Health Professionals, Your Questions Answered, is designed to be your guide to navigate complex ethical issues. Our book is not only designed to positively encourage you to think and act ethically, but also to help you avoid pitfalls. One goal is to foster client trust in your established expertise and your demonstrated integrity, because your actions also are ethically sound. Our book is authored by Jack P. Haynes and James Wendell and is published by the American Psychological Association. It is available at major online sources, including Amazon.com, the American Psychological Association, and also bookstores.